Let's speak about the gonadal vessels. So these are the vessels that are communicating with the gonads. And remember, the gonads are either the testes in males or the ovaries in females. These are coming off the aorta. So it's going to be the testicular artery or the ovarian artery that are coming immediately off of the aorta and going towards the bladder, towards the gonad, on either side. So we have the left gonadal vein and artery, and then the right gonadal vein and artery. Remember, these can be termed testicular artery or ovarian artery, depending on if we're looking at a male or female anatomy. And then the veins are going to be corresponding. So we're going to have the right and left testicular or ovarian veins that are communicating back to the inferior vena cava. So the anatomy is a little bit asymmetrical here as well because of the fact that the inferior vena cava is on the right side of the body and the aorta is on the left side of the body. The left gonadal, so the left testicular vein or ovarian vein, is going to dump into the renal vein because it's closer to the right side. Whereas on the right side, the gonadal vessels are dumping immediately into the inferior vena cava, okay? Whereas the artery is actually going to cross the midline and go directly into the aorta. So there's a bit of asymmetry with the veins in that on the right, it's dumping into the inferior vena cava, which is closer to the right side, whereas on the left, it's going to take a shortcut, dump into the renal vein, which is eventually communicating to the inferior vena cava as well. Okay, so let's get into the reproductive structures. Let's start off with an introduction on overview to the female reproductive structures here, the female reproductive anatomy. So first off, we have the bladder. So the bladder is sitting beneath and slightly anterior to the uterus. We can see the communication of the urethra to the external urethral orifice. We can recognize here the internal urethral sphincter, which is at the base of the bladder, as well as the external urethral sphincter, which is found in the urogenital diaphragm or the pelvic diaphragm. And then we can see the orifice itself. We can also see the vagina. So the opening into the female reproductive tract is the vagina. Then we get into the uterus here. And then we can see the fallopian tubes or the uterine tubes, the fimbriae of the uterus, of the uterine tubes, and then the ovaries, which is that the gonads in females. I also want to point out the internal uterine cavity. So this is where the fetus would be, the embryo would be implanted. So this is where fertilization ends in implantation inside the uterine cavity. This is also where menstrual cycle will shut off, right? This is where the blood will be located, and this is how it will shut off out through the vagina. I also want to point out the rectum, which is located posterior to the bladder, as well as the external anal sphincter, which is the anal sphincter located at the external anal orifice. So let's get into the other female reproductive organs and structures and kind of point them out and talk a little bit about their function. We've got the ovaries, which are the paired gonads. This is where ova develop. We've got the fallopian tubes, which communicate from the ovaries. So here are the ovaries. The fallopian tube communicate from the ovaries back towards the uterine cavity where, again, not fertilization, but implantation can take place. We've got the fimbriae, and the fimbriae are these kind of finger-like projections that are grabbing up the egg from the ovary and taking it back towards the fallopian tube. We've got the uterus, which is the large cavity here where implantation takes place, where the menstrual cycle is located or originating from. We've got the round ligament and broad ligament. So the round ligament is anchoring the uterus from the superior aspect towards the umbilicus as well, similar to the bladder. And it's going to be, and it's going to start here in the lateral aspects of the uterus, and it's going to communicate all the way to the labia majora, which is pretty much the lips of the vagina there. And then we also have the broad ligament, which is this larger kind of sheath-like ligament that is wrapping over the fallopian tube and helping to anchor the uterus in place, but also helping to anchor the fallopian tubes of the uterus as well. Here we can see an internal view of the uterus. So this is the uterus. Here's the uterine cavity. We've got the internal os, which is the internal opening of the uterus. We've got the external os, which is the external opening. We've got the cervix. So the cervix is the opening that communicates into the uterine cavity. We can talk about the fundus of the uterus, which is kind of the top here. And then we can see the vaginal cavity, which is communicating to the external vaginal orifice. Let's look at the external female genitalia. So we've got the clitoris, which is kind of covered by the clitoral hood, sometimes referred to as the clitoral prepuce, which hides or covers the glands of the clitoris. And the glands is pretty much the tip or the head or the pointed projection of the clitoris. And the clitoris is a collection of tissue, very sensitive, very vascular, very well innervated, nervous innervated tissue that is a part of the female reproductive tract. So it's responsible for arousal and that part of the female reproductive structure. We also have the labia majora, which is the outer areas of the vagina, and then the labia minora, which are the inner areas that are communicating towards the vagina. We have the vestibule, which is the actual opening to the vagina, and the vagina, which is the tube that communicates to the uterus. There's also the hymen, which is not shown here. It's a connective tissue membrane that actually covers the vaginal vestibule. And this is usually intact up until it's removed before sexual activity. There's the mons pubis. So the mons pubis is the superior or anterior region. This is the pubic region of the reproductive area. This is where we have the genital hair located in males as well as females. And then the glans clitoris, which I kind of mentioned earlier, is the actual tip or the edge of the clitoris, which is usually covered by the prepuce or the hood of the clitoris. And then we can also point out the external urethral meatus or external urethral orifice, which is the opening of the urethra to the outside of the body. Let's look a little bit more closely of what the clitoris is made of. So the clitoris, again, as I mentioned, it's highly sensitive, lots of nerve endings here. It is also well vascularized, very similar to the penis in the case of males. It's made of several parts. We have the glans clitoris, which is the tip or the edge of the clitoris. We've got the clitoral crus, and the clitoral crus is kind of the rest of the clitoris. It's really hidden here. So all of this is the clitoral crus, which is part of the clitoris, but again, it's hidden underneath the skin. And then we have the clitoral bulb, also called the bulb of the vestibule, which again is this hidden communication of the clitoris that although we cannot see it, it is also having that same nerve endings and same vascularization and same sensitive nature that the clitoris glands itself has.